most famous physical therapist on the internet.
Hello, Brad Heineck, physical therapist, and here I am today representing Bob and Brad, the two most famous physical therapists on the internet. In our opinion, of course. Bob is not here today, and I'm exactly one half of the Bob and Brad team, but we have someone even better to help us out. Chris the Pharmacist, say hello.
Hey guys, how's it going?
That's right. And today, we are going to talk about understanding diabetes head to toe, symptoms, treatments, as well as blood sugars and how you measure those. This is a pretty comprehensive video. It's not very short. This is a very complicated disease, and we want to cover all the aspects. So if you want to learn everything about this, if you are diagnosed or a family member is recently diagnosed and you really want to get some good information, this is going to give you everything you need to know. So bear with us if it's a part that you don't understand. I'm going to help Chris. He gets sometimes too complicated. I'm going to see if I can have him dumb it down so that everyone can understand it, including myself. So very good. Both physical therapists and pharmacists work with diabetics all the time.
Correct.
And there's things that therapists have to know about treating a diabetic so they are maintain their good health, and we can help maintain, monitor, and have good results with the patients. And
Absolutely.
And with pharmacists, you are very acute to what's going on with them and how to talk to them and educate them.
Yep.
Am I correct on that?
Quite correct. I mean, it's an unbelievably prevalent disease worldwide. You're talking about 480 million people on the planet.
Mm-hmm.
Within the United States, we're roughly around 35 million.
So that is about 10% of the United States population
Roughly,
have
Yep.
diabetes. And then there's type 1 and type 2. Is that
correct? There's type 1 and there's type 2. I mean, the bigger frame is diabetes mellitus. And within that framework, you got type 1 and type 2. Type 1 is what was usually recognized as what they call childhood onset, but that's not really true. It does occur, in childhood often or adolescence, but it can occur later in life as well, like even into your 20s. And that's the type of, it's the insulin-dependent diabetes exclusively.
So that means they have to give a shot to...
Yep, without insulin being introduced into your body, you would die. I mean, it's
so you can't treat that or change it with your diet.
No, it is. It's still a very important. Diet and exercise are still very, very important. We'll talk about that between the two.
Right.
But with type 1, it's interesting with type 1 diabetics. They tend to be your thinner patients. They tend to be pretty lean in general. But it has a variety of complications that we can certainly get into.
So the pancreas is what produces insulin and injects it, or not inject, but puts it into your digestive system. So those type 1 people, it doesn't produce insulin or not
Correct.
enough.
Yeah, what happens, and we don't really know fully why you become a type 1 diabetic, but what we do know is that whether it's a viral cause or just simply autoimmune, meaning our immune systems attack our pancreas, and you have alpha cells and beta cells, and your beta cells are the ones that make, and then there's the islets of Langerhans, just a guy that discovered it. Anyhow, those are the ones that make insulin. So when we eat food, our body generates insulin, so it can take up sugar and put it into our cells for further use for energy when we're exercising, walking, doing life.
With type 1, that pancreas is not doing that sufficiently.
Those specific cells die off. The immune system, for whatever reason, said, I don't like these things, and I'm attacking it. And, there's a lot of research going into that as to how we can fix this medically. So there are doctors doing research on transplants using stem cells.
Sure.
Artificial
what about genetic? Is type 1 a genetically,
if
I have it, are my children likely to have it?
There is a possibility. There's a strong genetic component with both type 1 and type 2.
Okay.
So it's one of those things where, if you have a diabetic parent or parents, there's a good likelihood that, and I see them in my store all the time.
Okay.
We have diabetic families. They'll just, mom, dad, and I've seen a combination of a 1 and a 2, and the kids are all 1s, and it just kind of depends on, you can't always outrun that. So, and that's the one thing that researchers it's very complicated, and researchers are trying to figure it out.
Sure.
And they don't have the key. They're getting better and better at things, but it is not easy.
Got a ways to go.
And worldwide, it's really interesting, and countries that don't have maybe the access to care like the United States does, sometimes it can actually be missed because sometimes it looks like other things, and time is everything, because there's this thing called diabetic ketoacidosis, which is actually can be fatal if not treated right away. So, and that's a lot of times how a young diabetic or an adolescent or just a type 1 approaches. They're really acidic, their sugars are through the roof, and so we want to make sure that we're looking at everything.
Let's talk about type 2.
Sure.
So type 2, is that the kind that typically comes with older people? It's like an onset because of
and that was the
lifestyle?
older, it was the older framework. We actually can see, you can have a type 2 diabetic that's 10 years old. So, I mean, I would say it's more lifestyle maintained. And a type 2 diabetic, one of the hallmark things.
But usually, is it 10-year-olds or is it 30 or 60?
It is going to develop later in life, but we're finding, particularly with childhood obesity, that we're seeing more and more children being diagnosed with type 2 diabetes, which in previous generations was just not a thing.
So type 2 is influenced heavily by lifestyle
and yep. So the thing that happens in a type 2 that's kind of a hallmark characteristic, we have plenty of insulin floating around in our bodies, but the cells that use it are resistant to it. So it's an insulin resistance category. And so when we don't exercise well enough, we don't eat properly, and we are overweight, those are things that and if there's a genetic predisposition towards it, it's a high likelihood that type 2 could develop. Now,
so with type 2, they typically are not taking insulin injections like type 1? Okay.
No, they won't start there typically. We'll manage them with, the first thing when you get your first diabetic diagnosis, if it's a type 2, is they're going to talk to you about modification of lifestyle choices. So
diet
and exercise are the first two things that, if you're going to be on medications, the first thing we're going to talk to you about is, no matter what, exercise well and eat well. And they'll probably put you together with a diabetic nutritionist, so a specialist. They'll probably have a nurse care specialist, your endocrinologist. There's going to be a team. And then the pharmacist will come in when we're talking to you about your medications.
So as far as exercise, as a therapist, this doesn't mean that you need to start running 5Ks, 10Ks, and marathons. We're talking about probably walking 30 minutes a day or work up to that.
Yeah, I mean, basically the guidelines are we want you to do 150 minutes a week, so 5 by 30 minutes. So walking, gardening, ballroom dancing, swimming, biking, running. I mean, you actually kind of be careful with exercise in diabetics too, because there are certain things like, say, weightlifting, where let's say there's maybe some diabetic retinopathy kind of issues. We'll get into that a little bit further.
With your eyes,
but or with your kidneys, sometimes we're pushing really hard or straining on a big heavy lift. They can cause some problems, and obviously in your arena, we have to be super careful with that with diabetics.
So the big picture is exercise does not mean you have to become an all-out exercise.
No, you're not.
You're just going to go 5 days a week, 30 minutes of elevating, like we said, walking, being active with things around your house is good for that. As far as diet, I think there's no real special diet. It's a lot of getting rid of your processed foods and
the processed
all the high
foods,
sugar.
Yeah, I mean, especially in the Americanized diet. I mean, we got fast food and we got processed food, and those are go-to because they're quick, they're easy, and you get quick.
Relatively inexpensive.
Yep, and that's one of the things that I think makes it so dangerous is everything's so cheap.
Yeah,
all the stuff that tastes good that's not good for you is cheap. And so if we can stay away from things that are in boxes and bags, I think it's a big thing. You want to go to whole foods, lean proteins, fruits and veggies. And within that, and if you talk to a nutritionist or a diabetic educator, they're going to talk to you about what's good fruits and veggies versus bad ones. And veggies, not so much, but fruits, some have more sugar than others. And they talk about the glycemic index, which can probably glaze everybody over if I start going into that. But
for example, I know grapes has a real high sugar thing.
Very
so
sugary.
I don't eat many grapes. I like them, but I like to stick to the berries.
Yeah,
that kind of
berries, blueberries. Bananas are a little bit lower glycemic index, about 63. So I mean, it's middle of the road. But I mean, so it just kind of depends on the things that you choose. And again, a diabetic educator and or a nutritionist, you will be talking with both when you get these diagnoses, because it's so important to incorporate those lifestyle changes early. And Rome's not built in a day. And diabetes is, like I said, it's 1 in 4 of all healthcare dollars in the United States are spent on diabetes.
25%.
25%. So you're talking about the average diabetic patient spends $9,000 a year annually out of pocket costs. So that's not the insurance cost. It's out of pocket.
Because we just had an amputee in here, and they were talking about dealing with the amputee, and the prosthetist talked about the percentage of people that get amputated in the knee or arm or whatever,
Yep.
typically in the legs, are highly, oftentimes diabetic. It's related.
Yeah, the number one. Yeah, well, when we talk about peripheral artery disease,
Yeah, we'll get into that. I do want to talk before we get farther, because we are going to cover 7 different topics that they're all kind of interrelate, but we tried to break it apart as typical symptoms. Let's say that you're not type 1 or whatever, you're type 2, or all of a sudden what do you feel? What does a typical diabetic notice before they're diagnosed?
You know, it's kind of odd. Whether it's 1 or 2, they're somewhat similar. Like in diagnosis circles, they're going to talk about the 3 Ps. It's going to be polyphagia, which is you're hungry all the time.
Okay.
Polydipsia, where you're thirsty all the time, and polyuria, where you go to the bathroom all the time. So
if
the 3 Ps,
all 3 of them, or just one of the?
No, all 3 of them are kind of characteristically all together. You'll see those as kind of a hallmark thing, whether it's, and then there'll be subsequent fatigue and you just don't feel well and things aren't right. You're not thinking clearly.
Is this consistent day to day, or does it come and go where you feel you have that for a few days?
No, it's going to be kind of think of a crescendo. I mean, it's going to start here and it's going to keep getting worse and worse and worse. So if you think of a big wave developing, you know how it starts kind of small, and then when it comes into shore, it gets bigger and taller.
Could it go up and down like that, depending on your diet?
When you first get diagnosed with type 1, there's this honeymoon phase where you can actually somewhat spontaneously recover, but that's very short and it's less than 6 months. But that's pretty.
You said again, type 2 is what percentage of diabetics?
95% type 2, 5% are type 1. Right. So you're talking about with it's a.
Sure. Okay. I just wanted to.
Clear that up. I mean, the problems all remain the same with the complications that are associated with it, and the diagnoses leading up to it. I mean, they'll be asking you questions about your family. They'll look at your age. They'll look at things that have been going on around you. Did you have an infection? So they'll look at the autoimmune aspects for type 1. So if it's a younger diabetic patient. Mm-hmm. So there's a lot of things that are very, very complicated for a doctor or a clinician to try and figure out at the onset of this. You come in and something's not right. One of the first things they're going to do is take blood work to make sure that they see, and the astute physician is going to look at your A1C, which is a diagnostic criteria. They're going to look at your glucose level, and all of a sudden they say, wow, 500, this is insane. Sure. And then they're going to immediately go into crisis mode and trying to figure out how we can protect the body, and then they'll start to figure everything out.
So typically, you don't go in to see a doctor on one visit and they say, oh, you're diabetic. They're going to ask a lot of questions, do a lot of blood work, a lot of other tests, and then you're going to come back and they're going to
it can be really scary stuff. It can be a crisis situation. You got a kid that's unconscious. You don't know why. They're not rousable. I mean, in a type 1 particular case, but as an adult type 2, the onset is much slower because Rome's not built in a day. And if we aren't eating well, we're not exercising well, and we're gaining weight. I mean, there's it's like they hypothesize that there's at least 8 million people in the United States walking around that don't even know they have diabetes, but they're diabetic. Again, that's going to be a type 2. Type 1, it's medical crisis. You don't get that treated, you're dead. Okay. I mean, it's that serious.
As far as like symptoms, a typical symptom that I've worked with patients, they get lightheaded. Whoa, you say, oh, they're diabetic. And then we come down and the nurses come down or whoever, or we get something like orange juice or something.
Yeah. So
that's some sugars.
When their sugar's low, it's called hypoglycemia or low blood sugar.
And that's when you get that lightheaded feeling.
They can almost behave drunk. There's a lot of things to be aware of. Because like you say, let's say that, they weren't feeling well that morning and let's say they brought you down for treatment and maybe they didn't eat breakfast that day.
Sure.
But I took my insulin though, or I took my meds, and all of a sudden it's crashing.
Sure.
And so they can be unstable, almost drunk-like.
Yep.
Just talking about things that don't make sense. I mean, they can present in a variety of different ways. And so, so a quick a little bit of orange juice. Sometimes they'll tell you to chew on lifesavers. We have glucose tablets in the pharmacy that are glucose gels. There's a variety of different ways. If it's really serious, I mean, they're going to give you a shot of glucagon to stimulate blood sugar production right away.
And what if it goes high, if it spikes? What are the symptoms?
Well, high, that's where you're not going to feel right. You're going to be fatigued, lethargic, cloudy thinkings. They sound kind of similar, don't they?
Yeah.
So it makes it kind of tricky. And so if it's
Yeah.
super high, you're going to present to the, I mean, what are they going to do? They'll probably give you a bolus of insulin. So they will treat you specifically with insulin, because when you have blood sugars over, then the marking would be 240, and that's milligrams per deciliter for,
Yeah, so those
but
numbers are.
there are
What's normal? What's a normal blood sugar?
yeah,
120.
well, yeah, for healthy people, it's going to be 80 to 120.
Yeah.
So
So what numbers are high?
after 120, you're starting to, but I mean, if you have what they call postprandial after you eat, our sugar is going to go up. So it would be uncommon for you or I to be like at 200 if we had a really starchy meal. So let's say we had some pineapple and I don't know, some coconut and some rice and some chicken.
Yeah, so it goes up.
I mean, it's going to go up, and it's going to
That's
be
normal.
variable with what you eat, but it's going to come down right away, because your body's going to uptake those sugars, put them in the cells, and then it'll be expunged when you have energy
Normal
needs.
cycle.
Yeah, and so with somebody that's, well, whether 1 or 2 and their blood sugar is way high, we have to watch out for that risk of diabetic ketoacidosis. And that can be actually fatal if not treated properly. And so the blood becomes acidic, the sugars are super high. So the clinician's going to recognize this.
Yeah.
But
so if you're at home and you know you're diabetic or whatever, and you get these symptoms, it's probably time to go to the ER.
Yes. Yeah. If you're
emergency room.
Yeah, and you should have a kind of and with new diabetics, you should, most doctors, they coach them, but you should have a kind of a diabetic rescue plan.
Yeah.
And your family members and friends should be aware of it. I mean, diabetes can be a long-term frustrating situation for people to deal with. It's a big blow when you say, Brad, I'm sorry, but you're diabetic.
Sure.
I mean, people think, oh my God, am I going to die? And no, the answer is absolutely not. It's a very treatable disease state that you can live forever. Do all the hopes and dreams can come true. It's not the end of the world. It's going to require work.
Yep.
And so we have to be willing to put the time in and, make some of those changes if it's a type 2. Type 1, you make your peace with using your insulin and doing all the things that are necessary.
Can we go on to, we got our list of 7 here.
Yep.
It's circulation, neuropathy, vision, internal organs, heart disease, mouth, and age-related issues. So let's start with number 1, circulation. That's a big one.
Yeah, I mean, our cardiovascular system, when you are a diabetic, whether it's 1 or 2, and this will be a standard thing, the longer you have diabetes, the more these risks become more prevalent. So when you're, let's say, a 30-year-old type 2 diagnosis or a 15-year-old type 1 diagnosis, it's not as advanced, but when we're 65 and we've had diabetes for a number of years, cardiovascular disease becomes a very real risk. And I mean, it can affect you in your 40s, your 50s, your 60s.
So cardiovascular, we're talking about a heart then?
Yep.
Or other?
Nope, heart, because basically with sugar, I mean, every single problem that we have in diabetes is a circulatory issue.
Okay.
So cardiovascular disease is much higher. I mean, you got a much higher risk for heart attack, much higher risk for stroke. So it's very, very, but part of those changes are because the sugars in our blood, it causes breakdown of vessels. It causes fatty deposits to develop. So it can cause
clogging,
atherosclerosis, which is the hardening of your arteries and clogging of your veins. It can lead to peripheral vascular disease, in your extremities, which can cause circulatory issues. It can cause issues in our kidneys, obviously issues around the heart. It can get just fatty deposits in your arteries, and then basically that can break off and become a stroke. So we have lots and lots of risks, and they actually talk about vascular issues and for microvascular and macrovascular. So macro, think of bigger.
Yeah.
Micro is in smaller, so more at the capillary level. So it becomes unbelievably complex as a clinician because the diabetic umbrella is so encompassing. So you list off those 7 things, and one of the things too with respect to that is so what is it? What do you do? What do we do to protect ourselves? Well, there's going to be medication therapy for sure. So whether you're going to be put on a statin, which is going to be absolutely critical to protect you, obviously hypertension, managing your blood pressure issues.
And this isn't all diabetics. This is where it can lead into this. But if you change your lifestyle,
no, it's going to be all diabetic. You're going to have those lifestyle changes, but if you don't make those lifestyle changes, this is your future.
Sure. Okay.
It's going to be managed with chemistry. And we still want you exercising. We still want you eating well. I mean, that should be number one, no matter what you do.
What about neuropathy?
Neuropathy.
Now that's a term that I think a lot of my patients really, they say, I've got neuropathy, but with diabetics and neuropathy in the physical therapy world, we're always concerned about people's feet.
Feet.
Circulation is not good down there. And then you become numb and tingly, and you don't have good sensation.
Yep.
Let's say you put your shoe is too tight, or you have a wrinkle in your sock,
Oh yeah.
and it pushes into the skin, and the skin breaks open.
You got the ulcer.
Then you get an ulcer that will not heal very well with a diabetic,
Correct.
and it can lead to an amputation. I've worked with a number of amputees as a result of a fold in their sock, or they stubbed their toe,
Yep.
broke something open, and it will not heal as a result of circulation and the other
Correct.
effects of diabetes. So, boy, that keeping your feet and your footwear
Yep.
properly.
Proper fitting shoes.
Yep.
Wearing wicking socks that are not like loose and droopy, I
Yeah,
guess
you
would be.
can't have the folds on the
No,
socks.
no, you want to make sure that everything's well fitting. I mean, from the toe box in your shoes,
Yep.
you know, probably like what I'm wearing today would not be probably good diabetic footwear.
You're not going to wear the pumps or the high heels. Where
No,
the
no,
pointy-
because you're gonna be cramping that, and that's one of the things with neuropathy. You know, it's a progressive issue too. I mean, it starts out in a lot of cases pins and needles burning,
Yep.
and then eventually it's just kind of numbness, and it can affect their gait. I mean, it can actually affect the bone structure of their foot. I
Sure.
mean, you can, and from a physical therapy aspect, I mean, there's so many. I mean, and sometimes people just can't see their feet, and you know,
Sure.
the ball of the foot is where most of those ulcers
Sure.
start, or your
Yeah.
toes.
Yeah.
And so again, it's the footwear issue. So we want to make sure we're taking care of that. You want to make sure you have regular doctor visits. You want to make sure they're looking, and you should inspect your feet daily. After you dry off, you should probably put a moisturizer on them. Vaseline is a very simple way to help to
Sure.
maintain that, but you don't want to put it between the toes because actually that's where sweat and because you
Yeah.
can get a variety of different skin infections too. So
Yeah,
we'll talk
yeah.
about some of that as well.
Okay, and again, I want to, because this is sounding pretty gloomy, but
It
I
does.
do want to give some bright sides. I personally know a diabetic. She wears a pump,
Yep.
so she has insulin into her system on a
On-
pump.
yep.
And you would never know it. She's got a very good job. She's very active. She's
Yep.
athletic actually,
Yep.
which helps. And she deals with it well. So again, I just want to say there's a lot of, if you
It's
choose
not-
to do your lifestyle changes, do whatever you have to do, what your
Yeah.
doctor and whatnot, coaches you.
Absolutely.
That's not all doom and gloom, but
It never
again,
is.
it's potentially that
But you
way.
got to work at it, and you got to realize that there's days that when patients feel frustrated. I mean,
Yes.
let's say you just went to a wedding last weekend. Well, I mean, there's always great food, and there's always things that we're maybe not thinking about. Maybe do I have the piece of wedding cake? Do I not have the piece of wedding
Yeah.
cake? What kind of ramifications are we going to do? Did I do enough dancing at the wedding to going to burn off some of those calories, or am I going to have to take an extra walk, or what's going to happen to me
Right,
tomorrow? I mean, there's so many, like I said, there's so many things with diabetes that makes it so incredibly complex to treat. And as a patient, it can be frustrating, but, realize that, if you can take a team, have a family member or friend that can help support you, have a plan to work on things.
Yep.
I mean, these are things that will help to minimize that. Most people on a pump are a type 1 diabetic, but that's not always the case. You can have people on pumps with type 2.
Sure.
And those pumps are incredible. It's kind of like having a fake pancreas just kind of put into you, and it literally gives you a basal level of insulin. That's that baseline level.
Sure.
And then when you eat, they are so incredibly
Sensitive.
that they can time. You can program it for your meals, what you're going to eat.
Mhm.
So they're incredible these days.
Sure.
So your endocrinologist is certainly going to be paramount in doing this. It's certainly something you don't see at the pharmacy level, other than people coming in to pick up their insulin for their pumps.
Sure.
But it's certainly something that has been life changing for many people. And
Good.
And again,
Good.
diabetes is a very livable disease. There's no reason why it's the kiss of death. I mean, but it does, if you don't take care of yourself, we can end up with an early grave. So I don't
Yeah.
like to scare people, but it's certainly something that we have to take. We have to be an active participant in managing our own
Yep,
disease state.
yep.
So, if we move to, the neuropathy, I mean, it's circulatory at the end of the day. Those nerves are not being bathed properly. But again, so if we move on to vision, where we start talking about
Mhm.
diabetic retinopathy, I mean, that's the leading cause of blindness and working class people throughout the world
Is as a result.
of diabetic retinopathy.
So what does that means?
That's- yeah,
As a result of the diabetic issues in your system, your retina becomes
Yeah, damaged.
Damaged.
And so it becomes part of the microvascular portion of diabetes. So this is
Mhm.
the small blood cells. And so in our eye, we have it can affect our lens. It can affect increase risk for glaucoma. It affects the retina,
Sure.
the macula. I mean, there's all parts of the eye that they're all
Yeah.
in tune with the cause, so we can see clearly.
Yeah.
And what happens is that because it becomes a circulatory issue, it breaks down the little capillaries in the eye that feed the retina and the macula and the optic nerve and everything else. I mean, just think of blood as your lifeline, and when those vessels don't break down, or when they're broken down because sugar has basically screwed up the whole mechanism for delivering nutrients and oxygen in blood, problems occur. And so in the simplest fashion, I mean, you can get floaties, your retina can become detached, your eye checkups are very critical.
So again, with this, it's the same thing. The maintenance, your lifestyle changes, and get things under control and actively manage it consistently.
Every single solution that we have comes down to lifestyle modification, eating well, using your medications appropriately.
Right.
I mean, there is no in between. There's no negotiating at this point. It's kind of like playing Monopoly where you go to jail. It's like do not pass go, you go directly to jail. If you don't treat your blood sugars well and with respect, it's going to create a cavalcade of problems.
Let's see, anything else? Like, what about the mouth? Is there some issues?
Yeah.
Is it with teeth?
Yep. So, well, again, circulatory. So, I mean, if we aren't getting good oral circulation in our gums, it can cause gum disease. It can cause periodontal disease. And we're a diabetic too. The one thing, because of all the circulatory issues we don't heal as fast.
Sure.
So when we were talking about, the neuropathy of the foot, a diabetic foot ulcer, we don't have that rich source of blood to come and just try and oxygenate and help that thing heal. And so there are a variety of different things that doctors do with that, but the same thing with a dentist. So you want your so you see how this adds up with the healthcare costs? So you're seeing your eye doctor, you're seeing a kidney doctor maybe, you're seeing your foot doctor, you're seeing your endocrinologist, you're seeing your regular GP. Yeah. So it's a team-wise approach to see, and then you're going to the pharmacy to get your stuff. And maybe you're paying your physical therapist to help you to improve your lifestyle, which in a lot of cases, physical therapists are paramount in developing exercise programs, how to do things properly, warning patients what to look for. So, I mean, they are so paramount in treating it. And actually, in a lot of cases, like with peripheral artery disease, which is circulatory again, physical therapy is better than drugs. So it's huge.
Yeah, appropriate exercise.
Correct. Right. And so, so going back to the mouth, because I just digressed, I'm sorry. I do that. With the period, again, it's circulatory, keeping your sugars in check, and making sure that your dentist is looking at those teeth. Because actually one of the things is when you have bad dental disease, you're not eating properly because you can't chew the right food. So what do you go to? All the easy, mushy, sugary stuff
comes around again.
So again, and worldwide, particularly not so much in the United States, but although in the United States it's a very prevalent problem, sometimes nutrition is hard to come by, or at least good nutrition is hard to come by. And so with the mouth, it's very important. Our internal organs, when we're talking about our kidneys, our livers, our hearts, they're all, again, it's circulatory. So you talk about diabetic nephropathy. It was one of the leading causes for kidney damage. And so we have a little filter called a glomerulus, and those fatty deposits into those little microvascular changes
so you're compromised throughout your gut, if you will.
For everything. I mean, when the average adult has, basically it's 100 million. It's 100 million miles of blood vessels. If we laid them end to end, it's 100. I mean, that wraps around the planet a few times.
Sure.
So that's what they theorize. A child has 60 million. So it's an incredible amount. And so circulation is key. And to manage it, it all comes down to blood sugar management.
So let's get to that. How do you measure? Because that's going to be a key thing. Once you're diagnosed, you're going to be responsible to measure your blood sugars on a daily basis?
Every day. It should become...
And that's where you poke your finger and you get a little drop of blood?
That's one way.
Okay. Yep. How many ways are there that you can measure?
There's actually, it's going to be a finger prick, or it can be through constant glucose monitoring. So, and that's one of the newer things that we have. They're actually wearable, implantable.
Put on your arm?
Yep. So they just have a special mechanism, and it has a little capillary that if you could picture, it would go in right below the surface of the skin. So it gets
something pokes into your skin.
Yep, and you wear it for 10 to 14 days, depending upon the manufacturer that you choose.
Sure.
And you have a little unit that's about the size, and actually it's even integrated with cell phones, but you just wave it right over the sensor, and it'll give you a real-time picture of what your blood sugar is at that moment in time, which is actually...
Wow. otherwise you're poking your finger, blah, blah,
Yep.
put it in the little machine, and
Yeah, and so
it's
yeah.
not a big deal, but
No, it's
it's not near
no,
as easy as
it's
that.
not a big deal. But I mean, when you talk to patients, the one thing that it's a little sting, so they get frustrated with it. It can cause thickening of the skin. So when we talk about diabetics, when they come in and actually checking, you want to use the side of your finger, not the tip of your finger. There's a lot more nerve endings here, so it hurts more if you use the tip. So you want to use the side. Some people, their circulation's not great, so you can run their hands under warm water to kind of warm that up, or you can actually do this
to get
just
so
get
they
some
get a
friction
better
going,
sample.
so you get a better sample. So sometimes that can get hard, especially a lifelong diabetic that's checking anywhere 3 to 8 times a day.
Oh, really?
Yeah,
That
it
often?
can be. So
Yeah.
people that are, that's why the constant glucose monitoring, and a lot of the pumps now are integrated with that too. So like Medtronic's and a variety of different companies.
So they put the pump on that monitors,
Yeah,
and that goes for more than 14 days.
Oh, yeah.
As long as the pump
yeah,
is
and they,
in.
yeah, and pump to pump, they have different varieties because they're going to load
Okay.
it with their insulin, and then also it integrates with how their blood sugar
So
is.
that gets pretty specific per patient.
Yes, yes. But insofar as just self-monitoring, I mean, the money's in the strips. I mean, when we talked about $1 in $4, I mean, you talk test strips. I mean, just an average box of 100 test strips is $180.
Oh, really?
Most insurance companies cover those.
Yep.
But if you take the new diabetic, the constant glucose monitoring, so there's the Freestyle Libre, the Libre 2, and then there's Dexcom, or the 3 units I'm most familiar with.
Okay.
They all, like the Dexcom, are 10-day sensors, and the Libres are 14-day sensors. They're a little bit cheaper than the strips, but interestingly, most insurance companies don't cover the constant glucose monitoring, which is strange because it's the most cutting edge, best possible information you can get to give yourself, and plus you don't have to prick your fingers, so it's way more comfortable. I mean, there's people, like the Freestyle Libre product, you can swim with it.
Oh, really?
Yeah, they stay right on. I mean, you don't take it off, you wear it for 14 days.
Yeah.
And so,
and then that information is documented. I imagine it's
Oh,
if you can refer back to it for future reference, possibly.
Yeah. And so, like I said, you heard me say, like, the test strip's about $180 for a strip. For like a sensor, it's about $60. So
Wow.
it's cheaper, but for some strange reason, many insurance plans don't seem to cover those sensors, and I don't fully grasp why as a pharmacist. This is me, because it's, when I talk to patients that use these devices, they love them. Their sugars improve. It tells them real time. They're like, "Oh my gosh, I'm low. It's time for me to grab a quick snack." Or I'm way too high. Gosh, I'm gonna go out and take a walk. Or just something. Or you just, oh my gosh,
you get to learn your body.
You learn your body much more effectively. All of a sudden, wow, I went on this and I lost 11 pounds. My sugars are great. I'm feeling better. I'm more active, more energetic. I mean, they really are an incredible tool because of all these things that we talk about, their complications.
Sure.
It's the simplest thing that we can do to help ourselves on a day-to-day basis.
Sure.
And a doctor uses a different tool called an A1C, which is done about every 90 days. And that's a snapshot of how well you've been doing.
Sure.
And that's what the clinicians use. But if you're using your blood glucose, your self-home monitoring devices, hopefully it will mirror what the physician sees every 90 days or 6 months or whenever you come in for your checkups. So it is a critical step in us helping to conquer the disease state itself. Is just being in the know.
Yeah,
Being in the know.
knowing where. I wanted to cover this earlier, and I should have brought it up earlier. I feel bad, but people in type 2, if you catch it early enough and you're not too far off, is that the point where lifestyle changes could
reverse it?
Or but not cure it, but at least make it very manageable without medication?
Yeah, absolutely. 100% yes. So I mean, and you can be a type 2 for 5 years and you just find religion and say, I'm done with all this stuff. You exercise, you eat well, you do everything your nutritionists say, your doctors say, you can get off the meds. It is a goal that I talk about with many of my patients. Like, hey, if you can work at this and you commit to yourself, because I think you're your own best asset. And so if you treat yourself as a $1 billion commodity, you're your $1 billion corporation.
Yeah.
And it's like, well, I want to make this corporation last for a long, long time because I have kids, I want grandkids, or I want to write a book. I
want to live.
You want to live. I mean, whatever your goals and dreams are, it should not crush them. Is my point. It's very livable, and if you're an active, if you pursue it actively yourself, you can beat the disease. Is not quite the right word because it's always going to be there in an underlying fashion. But you can reverse it, and to the point where you don't need medications.
Sure.
And doctors also. I mean, this is a little bit of a side note, but like there's patients that are candidates for bariatric bypass, which is the special stomach
Right.
procedure that
Reduction.
doctors reduce the surface area. And, you know, you're going to reduce caloric diet, and you
Yeah.
have it's very regimented and very difficult, and you have to be psychologically ready for something like that. But
Yeah.
a lot of people lose 100 pounds and all of a sudden they're off all their diabetic meds, all their blood pressure meds. So
Oh, really?
it's an option for people that just can't quite get it done. You know, sometimes we just need a
It's
little
a
help.
select group of people.
A
that
very select group, but it's something
becomes-
that's out there. And when you see all of a sudden you're like, I am no longer classified as a type 2 diabetic because I've made these changes. But they're also exercising and eating well, and you know, a lot of times too, I mean, they can clip a nerve that turns off the ability to even sense hunger. So there's a lot. It's
Oh.
pretty amazing stuff.
Is that
that's out there.
something pretty new?
Newer. Well, I don't know. I guess you'd have to talk to a gastroenterologist that specializes in it. A bariatric specialist, probably, it's not new to them, but it's newer, I think, to
Yeah.
us in the lay
Yeah.
world.
I don't
But-
want to get people
No.
the idea that
Everybody should have it.
get
No,
their nerve
it's-
clipped for hunger and they're okay.
No, it's not that simple. And you don't, you know, there's a cost to those things too, because people can forget to eat. So I mean, they have to set alarm and like, oh, okay, I'm supposed to eat at this time, and
Yeah.
and so
You're kind of messing with.
So again, that's a sidebar. It's not the end all be all. But I mean, I guess the point being is that if you can commit to those lifestyle changes, you will see improvement. You will see your blood sugars under better control. You will see overall better health. Because the one thing with all these things that we're talking about with complications are the longer we're diabetic and the less well controlled we are, the more severe and the more frequent these complications can become.
Yeah.
And so that's that diabetic umbrella. That's everything that's under there. I mean, it's the heart, it's the mouth, it's the nerves. You know, I mean, it's everything. It's stroke, it's vascular disease, it's your circulatory,
Yeah.
it's your eyesight, it's your kidneys, it's the amputations. I mean, when we talk about all these things, it sounds pretty dire, but if we are willing to put in the work,
Yep.
we can live with it and we can manage it, and we can manage it very
And
effectively.
prosper, it sounds.
Exactly. I mean,
So that puts you in control of it, which is a big relief. And I know when I have my patients with pain, particularly back pain, if I can show them some exercises or some things not to do and it puts them in control, it's like, oh, I can control this pain. Their whole life changes.
Yeah.
They just have to realize and accept what they need to do,
Yep.
and you do it.
yeah, it's like you have to almost treat it like a job. I mean,
Yeah.
and it's just like, all right, I'm packing my lunchbox with healthy food and I'm going to work.
Yep.
You know, I mean, it's one of those things that, cured, no, treated, yes. And I think if we're willing to commit to it,
Yep.
you could have a great life,
Yep.
an even better life. And there's athletes, there's movie stars, there's presidents, there's
Everyday people that you
everybody
may not even
that
know.
you don't even know.
Yep.
They just don't talk about it.
Yep. All right, very good. Hope we've covered. I think we covered it quite well. Maybe too well. I don't know, but good luck with it. It's can be a problem, but you can certainly overcome and live well with it. So take care, and thank you, Chris, for coming
Absolutely.
on and sharing all your knowledge.
Thanks, guys.